Introduction to Nursing Concepts, Nursing Process Part 4, Martha Olson. We will be talking now about the four-step or the implementation of the nursing care plan as we follow through with this series of slides for you to learn about the nursing process. When we look at that fourth step, we know that these are the things that we do or implement. It includes things that we delegate and assign tasks to other caregivers as appropriate. And the big thing to remember is we always remain accountable even though we delegate things. In class, we will be doing some delegation activities to help us identify what is appropriate to delegate. This fourth step in the nursing process then becomes the implementation or the doing, the hands-on. If you're coming to nursing knowing that you like to work with patients, you will like the implementation phase because this is the actual being on the floor and doing things for your patients. Chapter 19 is devoted to this part of the nursing process. So far, we have collected the data, we've set our priorities. Now we need to perform these nursing assessments. And to continue, our assessment is part of being effective with our implementation. Your patient status will change continuously, and we need to note those changes early so we can make the corrections and let the doctor know if we have any concerns in the change in that assessment. We have to have psychomotor skills to be able to do the hands-on tasks. We have to have interpersonal skills to be able to talk to the patient and interview them and ask them questions about their pain and their ideas or wishes of what needs to be done. And then our cognitive skills are those higher level skills to be able to plan and to think about what we need to do with our critical thinking. We need to know our agency policies and procedures to know what we are able to do in our job as a nurse. There are types of nursing interventions that are independent. We can do them and initiate them on our own. Turning a patient every 2 hours because we're worried about skin breakdown is one. Dependent, again, we have to have a physician write an order and allow us to do things, but then a lot of that is up to us to determine how often they might need a PRN pill for their pain or other things that go along with that critical thinking. And then again, the collaborative is working together with physical therapy and social work to give the patient the best outcome. As we prioritize all of our nursing care, we always want to remember going back to airway, breathing, and circulation. Our airway problems become that priority no matter what else is happening. If your patient isn't breathing, we need to open the airway, apply oxygen, and begin CPR if necessary. Circulation or cardiac problems, and then our vital signs become a concern as well, because if they are hemorrhaging and their blood pressure is falling and their pulse is elevating, that's telling us that they are in trouble and we need to intervene very quickly with our nursing care. Our second level of priority problems then are changes in the mental status, and a lot of that is because if they have a hemorrhage to the brain, they need surgery right away. Mental status changes can also be from, maybe drug overdose or too many narcotics given to them. So we need to make that a priority when we notice that their mental status has changed, especially when it's very rapid. Any acute pain becomes a priority. Any problems with urinary elimination, because that bladder can only hold so much volume of urine, and the patient is very uncomfortable, but can also experience some severe physical problems as a result of that lack of elimination. Untreated medical problems, abnormal lab values need to be called to a physician so we can get things turned around or something initiated to help solve that problem. And then our risk for infection, safety, and security are also on that second level of priority. So let's try a few of these to see how we're doing. Encourage morning hygiene or relieve pain. Hopefully you selected relieve pain. Stabilize and ensure adequate oxygenation or assess elimination status. Oxygenation is our priority with that one because that goes along with airway. When we perform our nursing interventions, we need to remember, what does a nurse need to know before we do something? And that's why we get report on our patients. That's why we continuously assess them and check on them frequently. We need to include the patient and family and keep the environment safe for that patient if they have been unable to walk up to this point, maybe just standing and pivoting to the chair is going to be safe, but also promote circulation and promote mobility for them. So we need to know what kind of patient we take care of and what is the norm for the institution that we are working in at that time. What is the role in each of these areas? We need to assist them with their activities of daily living, eating, if they have problems swallowing, assessing for dysphagia, giving direct care. We do a lot of teaching as we work with patients, new mothers, all the teaching we do before they go home, a new surgical, lots of teaching and counseling, and then delegating. But remember, we supervise, and we also have to coordinate that nursing personnel that are getting the tasks that we have delegated to them. And then our documentation is the recording and exchanging of information with other people on the healthcare team so that everybody knows the changes for that patient. Our fifth step then is to evaluate how we did. Did it work? Did it not work? Did the changes that we made resolve the problem, or do we need to go back to looking at the problem and figuring out what else we can do in our nursing cares that will help improve for that patient? When we ask, was it achieved? Was it fully achieved? Was it maybe partially achieved, or did we not meet it at all? And then we need to ask why. What interventions can be changed and what can we do differently? That evaluation is what we call a fluid process. It depends on a lot of other things in the nursing cares. We need to evaluate early so that if we need to change things up, we have time to do that. And then we need to correct our problems early as well. Some of our evaluation activities include assessment. Look at lab values. Are they normal or abnormal? Has that change occurred to where now they have bowel sounds when they didn't have bowel sounds before? We evaluate things that we observe and we measure. We question the patient, trying to find out, are they feeling better? Are they feeling worse? What is going on with that patient? We plan then, and then we implement or do in that nursing process all of those things. When we get down to the evaluation, we want to look to see, have they improved? Did they get better? Was that goal statement to the desired client behavior response, or do we need to look at that again? If a goal is met, then we discontinue it, but we might need to make another one and revise our plan of care as indicated. 3 alternatives when deciding how well an outcome was met. The patient was able to demonstrate the behavior fully, then it was met. If they could only walk 50 feet in the hall when we had projected that they would walk 100, it was partially met because they did part of it, and then not met at all. Maybe the patient was not willing or unable to perform that. So our nursing care plan components then become that first assessment we do. We look at that nursing diagnosis, our goals or our objectives, outcomes, the interventions or things we do, and then we always evaluate at the end to see, was it met or not? The role of the RN then in the nursing process is to continuously assess our patients, to look at that nursing diagnosis and plan what's going to go on. We give the direct care, we monitor them continuously. Again, we counsel and teach the patient, we delegate, and then the last thing we always do is chart. There are different types of care plans that are out there. The student-oriented ones will be what you do when you get to clinical. There are standardized care plans where every patient that has a vaginal delivery gets a care plan that's pulled from a chart, and then we individualize it as needed. Some of your institutions have care plans that are already in place, and we follow those to the best of our ability. So there are different types of care plans out there that we can see. The role of the nurse then is to write the nursing diagnosis, to perform the nursing activities as appropriate, and then evaluate at the final step, was it met, was it partially met, or not met at all. And as we evaluate, it helps us to make changes to help or improve the outcome for that client. This ends part 4.